15 years ago in 5 days, so 15 years and 5 days ago, the Affordable Care Act, aka Obamacare, was signed into law. Now, we have a lot of discussion going on about, universal health care. Should everybody get free insurance? And was Obamacare, is it beneficial and did it help? In this video, I'm going to break down how Obamacare helped or how it destroyed the healthcare industry and how the comparison between the American insurance and Canadian. But before I do that, let's get into this video clip of President Obama and his promise to Americans when it came to the Affordable Care Act. Check this out.
If you're one of the more than 250 million Americans who already have health insurance, you will keep your health insurance. This law will only make it more secure and more affordable. Insurance companies can no longer impose lifetime limits on the amount of care you receive. They can no longer discriminate against children with pre-existing conditions. They can no longer drop your coverage if you get sick. They can no longer jack up your premiums without reason. They are required to provide free preventive care like checkups and mammograms. Young adults under the age of 26 are able to stay on their parents' health care plans. Seniors receive a discount on their prescription drugs. And by this August, nearly 13 million of you will receive a rebate from your insurance company because it spent too much on things like administrative costs and CEO bonuses and not enough on your health care. All of this is happening because of the Affordable Care Act. Today, I'm as confident as ever that when we look back 5 years from now, or 10 years from now, or 20 years from now, we'll be better off because we had the courage to pass this law and keep moving forward.
Now, the question at hand is, was President Obama able to keep that promise to the American people? I'll let you be the judge of that. Check this clip out.
There are more signs Obamacare could raise insurance rates for people who are already insured. In Georgia, the co-founder of the Tea Party Patriots voiced concerns after a recent letter from her insurance carrier. It showed her policy will no longer be available. And in that state, the new healthcare law will raise costs for a 40-year-old male non-smoker from $122 a month to $325 a month. And there are other more confusing facts about the changes.
The factors they list are all real and important. The actual numbers they list may not apply to any individual Georgian. The set of benefits for everybody is included that. So yes, when you buy, as a male, when you buy coverage, maternity care will be covered there.
The latest Associated GfK poll shows that 3/4 of people who have tried to sign up for health insurance through the health exchanges have reported problems.
So in other words, when you signed up for Obamacare or the Affordable Care Act, services, whether you need them or not, are included in the pricing structure for the policies that they present under Obamacare. And it's not like we weren't warned. And I'm going to get into the next clip, but we had warnings before. Right here in this article is one of the many that was written on October the 30th, 2013. Now, this is 3 years after the act had already been signed into law, but it was giving us forecasting. Obamacare, the biggest insurance scam in history. Written by Kevin Zeese and Margaret Flowers. And I'm going to just read a small part of this. Truth out is an indispensable resource. Oh, again, is that the Affordable Health Care Act, ACA, also called Obamacare, may be the biggest insurance scam in history. Number one, most people don't know the Affordable Care Act and Obamacare are the same thing. The industries that profit from our current healthcare system wrote the legislation, heavily influenced the regulations, and have received waivers exempting them from provisions in the law. This has all been done to protect and enhance their profits. So the insurance companies that Obamacare was supposed to be protecting us from are the ones who wrote the legislation. And then when they wrote all these rules and regulations for everybody else, they got and created waivers for themselves so that they wouldn't be penalized when they don't uphold those same exact regulations. Astounding. In the meantime, the healthcare crisis continues. Fewer people, even those with health insurance, can afford the healthcare they need because of out-of-pocket costs. The ACA continues that trend by pushing skimpy healthcare plans with low coverage and restricted networks. But as things went on and Obamacare began to tank, again, we had more signs. As a matter of fact, President Obama came out and he apologized for misspeaking when he made promises to everybody that they could keep their plan and they wouldn't be any changes to their current insurance that they had. And it had a whole bunch of people saying, whoa, yeah, this is awesome. Let's jump on this train. You had some conservatives okay with it. Almost every Democrat was okay with it. But check out this clip on what Obama says actually happened and why he was forced to apologize. Check this out.
President Obama has apologized to Americans forced off of their health insurance plans by his healthcare overhaul. For years, he repeatedly said that people who were satisfied with their coverage could keep it. But millions have already learned they're losing their insurance because their policies don't meet the requirements of Obamacare. In an interview with NBC News, the president said he did not do enough to ensure that the law did not force people off their plans. He says his administration is working to close some of the holes and gaps in Obamacare.
I am sorry that they are finding themselves in this situation based on assurances they got from me.
Meanwhile, the president's apology isn't enough for Republicans. In a statement, Senate Minority Leader Mitch McConnell said, if the president is truly sorry for breaking his promises to the American people, he'll do more than just issue a half-hearted apology on TV.
If you're enjoying this video and you like the content, do me a solid, hit that like button. I'll never ask you for a cash app, and I'll never ask you for a super chat, because you hitting that like button, that is currency. It helps spread the video around. And if you aren't subscribed to the channel, subscribe. On the Real Politics Podcast, that's what we do. We talk real politics. So once you subscribe, hit that notification bell and then select all. That way you'll be notified when I upload new videos. So after all of the promises that Obama made to the people that they would not lose their coverage and their costs wouldn't go up, it was a flat out lie. And does that surprise you coming from a Democrat? Knowing now, you know, how much propaganda they use and how the media is just an extension of the Democrat Party. We had no idea at this magnitude that CNN, MSNBC, and all these networks were pushing propaganda, and that the Affordable Care Act would do everything, the complete opposite of everything that he promised. So not only did he have to issue an apology, he gave a full-throated apology when he was called out about it even years later. Check out his response as to why nothing went the way that he said. Check this out.
Pledge I made that if you like your plan, you can keep it. I think, and I've said in interviews that there is no doubt that the way I put that forward unequivocally ended up not being accurate. It was not because of my intention not to deliver on that commitment and that promise. We put a grandfather clause into the law, but it was insufficient. Keep in mind that the individual market accounts for 5% of the population. So when I said you can keep your health care, I'm looking at folks who've got employer-based health care. I'm looking at folks who've got Medicare and Medicaid, and that accounts for the vast majority of Americans. And then for people who don't have any health insurance at all, obviously that didn't apply. My commitment to them was you're going to be able to get affordable health care for the first time. You have an individual market that accounts for about 5% of the population, and my working assumption was that the majority of those folks would find better policies at lower costs or the same costs in the marketplaces, and that the universe of folks who potentially would not find a better deal in the marketplaces, the grandfather clause would work sufficiently for them. And it didn't.
No crap. So he just stood up there and told us what we already know. Little did we know at that time that the entire bill, the legislation, the law was written by the same insurance companies who you say you're trying to cap their profits. But the opposite happened. These insurance companies actually made record-breaking profits, and they stuck it to the American taxpayer harder than ever before. As a matter of fact, even back then, President Trump was extremely consistent. When the presidential election of 2016 was going, or should I say, when 2012 was going on, and President Trump at that time was considering throwing his hat in the ring. You had Barack Obama, you had Hillary Clinton, and you had Donald Trump. At that time, Donald Trump was still a Democrat, and he wanted to lead the party because he saw how crazy it was going. And once he realized that the lefties took over, he said, man, the Republican Party is actually the party of common sense. But in this next clip, you're going to hear what they found, what the Senate found in Obamacare, and you're going to hear what President Trump's perspective was back then and just how consistent the man has been. Check this clip out.
Well, the next Obamacare open enrollment period begins November 1st, and customers are finding their options are dwindling and their premiums are skyrocketing. Not a good combination. Fox News' Dan Springer has the latest.
When Health Republic Insurance of New Jersey announced it's shutting down, it became the 17th failed health co-op since Obamacare started 3 years ago, leaving just 6 viable co-ops and many people scrambling for coverage. This as insurance premiums are going up double digits in most places, just the opposite of what then candidate Barack Obama said would happen.
If you've got health insurance, if your employer is doing the right thing, we're going to help that employer save $2,500 per family per year.
Insurance companies are asking for big premium increases, none bigger than the 60% hike sought by Blue Cross Blue Shield in Texas. Critics say they saw it coming.
That basic promise that it's going to make healthcare more affordable, it's not making healthcare more affordable. It's making healthcare more expensive.
The problem remains a risk pool with too many sick people and not enough who are young and healthy. Insurance companies are forced to raise premiums or leave the exchanges, which they're doing in droves. Just yesterday, 27,000 people in Indiana learned their Obamacare plans are going away.
That's going to be the future, and I think what we're seeing here is the beginning of a death spiral as far as the exchanges are concerned, as more and more companies pull out.
The Obama administration points to fewer uninsured and a slower growth in healthcare spending as successes, with the Holy Grail still a public option.
If a public option could bring premiums down, primarily by paying doctors and hospitals less and having lower overhead and no profit, that would lower federal government costs.
The presidential candidates are polar opposites on what they would do. Like President Obama, Hillary Clinton favors a public option that would compete with for-profit companies. But Donald Trump wants to increase competition by allowing people to buy their insurance across state lines.
So even back then, President Trump was already on, hey, listen, let's let competition roll, while Obama and Hillary Clinton are more so for this government option. Now, let's listen to some of the people who are actually been involved with Obamacare and how it impacted them. And we're going to hear some real numbers about just how much prices have gone up for people and are still going up. Check this clip out.
For those with employer-sponsored insurance, the average single deductible has increased by more than 57% since 2013, while the average family deductible has risen by more than 55%. Notice they say since 2013. Do you know what happened in 2013? That was called the Affordable Care Act, aka Obamacare. Remember, the whole purpose of Obamacare was to make things more affordable. And I was even doing podcasts. I had an older podcast back before this too. But I'll tell you, I was even predicting then, I said, guys, if Obamacare passes, watch healthcare costs skyrocket. Well, they haven't just skyrocketed. They've even allowed the deductible to skyrocket on you as well. So it means that you're now coming out of pocket more, even though you might maybe save, depending on your income, you might save on your premiums. But I know everybody I talk to, they say, oh man, health insurance premiums are ridiculously out of control. Why? Because they're not qualifying you on your health anymore. They're now saying, oh, we have to universally cover everybody. They want a universal health insurance, right? Everybody gets covered.
This was the precise moment I no longer was a Democrat.
Raise your hand if your government plan would provide coverage for undocumented immigrants. Okay.
That was the precise moment that I knew I was leaving the Democratic Party, because I was a 2-time bone cancer survivor. I voted for Obama-Biden based on Obamacare. And when it was implemented in 2010, I ended up losing my insurance. I went from an insurance plan that was $185 a month with a $1,000 deductible to that policy being canceled because it no longer met the requirements of Obamacare. And I was left with the cheapest option being $1,200 a month, $6,000 deductible. $185 a month, $1,000 deductible to $1,200 a month, $6,000 deductible.
That's highway robbery. And that's playing with this man's life. That's despicable. God. That's playing with his life. $185 a month to $1,200 a month and a $6,000 deductible. Okay. That's what Obamacare brought. And that's why Trump's push to get rid of Obamacare, eradicate it, and allow the private market to compete. Being competitive, helping them, try to do things as far as price-wise and service-wise to cater to the customers, because those who provide the best services get the most customers. But Obamacare came in, and what it did, it eliminated competition, consolidated a pool of doctors, and provided some of the worst levels of care available. But people always talk about the Canadian healthcare system and how much they wish that they were there in Canada, and how healthcare for all would be great if we had it here in America. You know how they say you should be careful what you wish for? Check out this report on what's going on in Canada when it comes to their healthcare system, because if we think Obamacare is bad, check out what universal healthcare looks like. Check out this clip.
The healthcare Canadians get within the country can vary depending on where you live. That includes wait times for different types of care, from the time of a referral to getting the treatment they need. Saskatchewan has the shortest median total wait at 15 weeks. However, people in New Brunswick are waiting 10 months, the longest in the country. And this problem is getting worse. Compared to 1993, it looks like all Canadians are waiting weeks longer to get the care they need. And the rise in wait times is happening despite the fact that Canada had more physicians in 2018 than it did the year before. The latest number saying it had nearly 90,000 of them.
Physicians don't necessarily work full-time. Many physicians will work part-time and do other things. Because physicians work on what we call fee-for-service, so when they do a service, they get a fee paid to them from the government. They can make a pretty good income, many of them, by not working full-time, so they choose to do that.
In this year's election, all of the main political parties have promised to make sure all Canadians have better access to care, even for minorities who may have the most trouble getting it, like people within the transgender community.
We need a national strategy around wait times, and I think we need a wait times guarantee. I think the federal government should insist on that as part and parcel of funding that they give to the provinces.
Now, people talk so negative about our healthcare. Now, Obamacare is horrible. It's terrible. But look at what's going on over there in Canada right now. It was 10 months. For some people in certain areas, it's even longer than that. And what if you have a grave illness where your life depends on it? You don't have 10 months and you need to get some type of treatment that can help you extend longer than 10 months. That's what universal health care gets you. It gets you super long wait times, no specific doctors. It's just a pool where you just have, so you have no relationship with your doctor, your physician. They don't know anything about you and everything is by random. And then you have people that think, oh, you know, Canada's healthcare is free. It's free. That is not true. As a matter of fact, let me allow a Canadian to explain it to you how their universal healthcare system is not free. As a matter of fact, in a lot of ways, they could be paying more than Americans. Check this out.
Many people will tell me that they believe the Canadian healthcare is free. Everyone go to Canada because there is free healthcare. And that, unfortunately, is not true. The way that most Canadians are charged for the healthcare is through income tax collection, and a component of their income tax then gets set aside and put towards the healthcare. Exactly how much? It's about 28 to 29% of all the taxes that you're paying on average go directly to funding your healthcare. The median dual person household salary in Canada for 1 year is about 120,000 Canadian dollars. Which means that as a basement, whether or not you access healthcare or not, Canadians are paying about $14,000 per year for their healthcare for their family.
$14,000 for healthcare for their family. Theirs is through taxes. And the Democrats push you to do what? They want everybody paying higher taxes, getting worse services like over there in Canada. So they're paying high taxes and they have horrible healthcare. But it's free, right? It's free. That's the word. And it's not free. Nothing in this world is free, especially when you're dealing with governments and you have corporations and companies where there's profits on the line. Get that out of, I wish people would just get that out of their head. It's non-existent. But I wanted to jump in since this is the 15th year and hopefully the last year that they celebrate anything about Obamacare, because they just had an anniversary for it, another anniversary. And it's like, no, we need to eradicate that plan and come in with a new healthcare plan that could truly service and help Americans. Now, what that looks like, that's going to be up to the experts in the Trump administration. But from what I understand, with RFK at the helm, you know, with Maha to make America healthy again, they've got a plan and we just waiting on them to roll it out. So listen, if you've hung out and you watched the video this far, thank you so much. And like always, remember to like the video, share the video, leave a comment. What do you think about the healthcare in America versus Canada? And subscribe to the channel if you haven't already subscribed. I'm Brian Maxwell. Hey, listen, I appreciate you for watching from the bottom of my heart, and I look forward to seeing you at the top. Over and out, y'all.